Ayan, ako po si Louis Vlog. Ayan, don't forget to subscribe para alam niyo yung mga susunod na topic. Yan, ang topic natin ngayon is about stroke. What is stroke in the signs and symptoms for men and women? There you go. You can see this picture. Makikita nyo guys the normal carotid and the diseased carotid and the blockage one. Yan. What is stroke? Ano yung stroke? Stroke is also known as a brain attack. It occurs when there's a blockage or rupture in the blood vessels that supply oxygenated blood in our brain. There you go. Pag nagkaroon guys ng blockage ang ating brain, ayan, nagkakaroon tayo ng brain attack kasi there's no blood supplies that going around our brain, and then magkakaroon tayo ng damaged cells. Yan. That's our brain in the normal brain. Yan. To understand about stroke, we have to understand about what our brain works. Brain controls movements, brain controls emotions, and our brain controls language. The brain usually controls many functions of the body like breathing and digestion, guys. Yan. To work properly our brain, it needs oxygen. Our brain weighs 2% of our body, diba? 2%. But needs 20% of oxygen you breathe in. Ayan, 20% sa mga oxygen na there are two types of stroke. Yan, dalawang klase. Ischemic attack or stroke. Ito yung mga stroke na usually na nangyayari sa mga kapatid natin. Yun yung picture. Makikita yung itim doon. That's the blockage one. This occurs when blood clots occurs through the artery that supplies oxygenated rich blood. Fatty deposits that building up the arteries cause constricted. This is called plaque. Most strokes, 87% is ischemic. Ayan. Number 2, the hemorrhagic attack or stroke. Ayan, makikita yun sa picture. Nag-rupture siya. That's what we call hemorrhagic. Hemorrhagic stroke occurs when blood vessels ruptured or burst in the brain. Blood builds up and damages surrounding the brain tissues. Both types of stroke damage brain cells, and it usually in the body parts that your brain controlled. It could be your speech, right or left, body. Yan. So, nagkakaroon tayo guys ng sakit ng ulo, dizziness, pag nagkakaroon tayo ng stroke, numbness o numbness of the hand or the half of the body. Yan. Yung mga nararamdaman natin. There are two types of hemorrhagic stroke also. And one is intracerebral hemorrhage. Ano ibig sabihin nito? This is the most common types of hemorrhagic stroke. This happens when the artery in the brain burst or rupture and flooding surrounding tissue with blood. Ayan. Kaya nagra-rupture, tsaka yung dugo, yun yung nagkaklat sa ating ulo. Ayan. Subarachnoid hemorrhage. Yan yung pangalawa. It is less common hemorrhagic stroke. It refers to the bleeding in the area between the brain and the thin tissue that covers it. Yan. This types of hemorrhagic stroke hindi masyadong common na nangyayari sa mga taong na i-stroke, guys. Ayan. There is another type of stroke. It is what we call the TIA or the transient ischemic attack. This is sometimes called the mini stroke. Bakit mini stroke? It is different from two major types of stroke because blood flow to the brain is blocked for a short period of time. It is usually not more than 5 minutes. Ito kasi yung stroke na parang biglaan pero nawawalan siya ng Tapos bumabalik din kaagad, guys. Pero this is the early signs of strokes, guys. Wag na nating i-ignore. Kung ignore natin, kasi ito yung signs na magkakaroon ka ng stroke pag hindi mo siya na-treat o na-agapan. Important to know about TIA, guys. Yan. Ang TIA is a warning sign of future stroke. Ayun. TIA is a medical emergency just like the major strokes. Strokes and TIA require emergency. So, pag nakita natin ng mga tao na ganun, guys, we have to call right away 911 or ambulance right away or any healthcare team, guys, to bring them to the hospital. Yan. There is no way to know from the start if whether symptoms are from TIA or major types of stroke. According to study, more than 1/3 of people experience TIA. If they don't treat this one, a major stroke within a year, sabi dito. 10 to 15% of people experience TIA, get major stroke within 3 months. Ayan. Kaya, guys, wag nating i-ignore, guys, yung mga symptoms na TIA, guys. Kasi nawawala din kaagad. Tapos inignore natin, hindi tayo nagpagamot. And that's very dangerous. Recognizing and treating TIA will decrease the risk of having a major types of stroke. Regular checkups and blood pressure monitoring helps you prevent a major stroke. Dito kasi pag yung mostly kasi mga mga hypertension patients or people, they usually have their medication. Pero sometimes, hindi kasi nila, ini-ignore nila, hindi nila iniinom, and they don't go for blood pressure monitor. Kailangan natin to prevent stroke, guys. Now, what are the signs and symptoms? Ayan. Mapababa yung lalaki, ito pa rin yung symptoms, guys. Symptoms ng ating stroke. Number 1, a sudden numbness or weakness in the face, arm, leg, especially side of the body. Sudden confusion, slurred speech, difficulty to understand words, sudden trouble walking, dizziness, loss of balance, lack of coordination, sudden severe headache with unknown cause. Ayan. O wag na nating i-ignore, guys, yung kasi it's a really sign of mataas na yung blood pressure natin, nagkakaroon na tayo ng stroke, guys. Yan. Magnanab na yung mga kamay natin, mukha, yung mga paa, yan, hindi na tayo makalakad, ganun. Kakaroon tayo ng mahirap tayong magsalita, yan. At saka parang nawawalan tayo ng malay, yun. Hindi natin alam kung anong nangyayari. At saka sakit ng ulo, guys. Number 1, minsan nararamdaman natin masakit ang ulo, parang lumilipad tayo sa ulap, parang ang gaan-gaan, parang wala lang ganun. Ayan, yung pananakit ng ulo natin, wag nating ignore yan, guys. Hindi natin alam kung anong nangyayari sa atin. What to do when you see person suspecting a stroke? Anong gagawin natin? Yan. Acting fast is the key for stroke. Ayan. What is fast, anyway? Ano yung fast na sinasabi dito? This is an assessment. Assessment yan, guys. Yan. Ang fast is F. It stands for face, mukha. As person to smile, that's one side dropping. Ano yun? May nakikita kayong changes na iba yung pag nag-smile siya. Arm, ask person to raise both arms. Ayan, ask them to raise their arms. Kung hindi nila maitaas yun, ibig sabihin, may weakness. Speech, ask the person to repeat a simple word. Was it slurred or strange speech? Ayan, kung doble mo yung salita at hindi niya nasabi or nabulol-bulol, ayun na. Time. If you see any of these signs, call 911 right away or call the ambulance, guys. Yeah. Wag nating dalhin sila sa hospital kasi if we need life-threatening kasi guys ang stroke. Maaring mamamatay yung tao. Pero pag sa ambulance, at least nabibigyan siya ng oxygen kaagad, yun, nare-revive. Note, if you see, yan, pag nakita niyo yung mga taong ganun, huwag niyong i-drive. Ambulance na lang kasi in every minute, maraming namamatay na cells, ng brain cells ng isang tao pag na-stroke, guys. Kasi wala ng oxygen, guys. They need oxygen and maybe they need CPR or first aid. Yan. Number 1 kasi, guys, sa na-stroke, kailangan talaga ng oxygen kasi kulang na kulang ang isang tao ng oxygen. And in 5 minutes, guys, marami ng either baka mamamatay pa yung tao, guys. Ayan. Kaya mas maigi na na ambulansya or pag nasa ibang bansa tayo, guys, it's 911 is the best to call for help. Yan. We need the healthcare team for this because guys, ang stroke really, it's a life-threatening condition for one person. Mamamatay ka talaga pag nawalan talaga. In 5 minutes, mamamatay ang tao pag ganun. Ayan, stroke in men is the 5th leading death in men. Usually cause of long-term disability. And men under 44 years old hospitalized for ischemic stroke. And the higher rate than women. Ayan, mas higher rate daw ang mga lalaki sa pagkakaroon ng stroke, guys. Ayan, bakit kaya? Tingnan natin. Tingnan natin. Ayan, what are the risk factors of stroke for men? Ayan, tingnan natin kasi anong pagkakaiba. Yan, number 1, smoking. More people, kasi more men, they smoke, right? Rather than women. Kaya yun, ang pagkakaiba kung bakit more high risk sila ng stroke. Overweight and obesity increase. Ayan. Hindi naman kailangan overweight. Meron naman din mga malilit ang katawan pero na-stroke sila. Bakit? Ayan, diabetes increase stroke. Ayan, diabetes. Kung may diabetes ka, more prone ka rin pala sa stroke, guys. Kasi the high level of sugar in your blood, it makes it thick, your blood, and it can't, hindi siya circulate na maigi. And our brain needs really an oxygenated blood to work well. Ayan, too much alcohol intake. Ayan, ang mga lalaki kasi di more on alcohol, guys. Palainom sila, guys. Ayan. And alcohol intakes increase triglycerides. And this is the fats that harden arteries that can lead to stroke. And sedentary lifestyle. Ito, number 1 to, guys. Not getting enough physical activities can lead to other health condition. Hindi lang stroke, guys. Kahit na magkakaroon ka ng maraming sakit pag nakatingga ka lang sa bahay, wala kang ginagawa, kain lang ng kain, everything, hindi ka gumagalaw, hindi ka nagpapapawis. Ayan, syempre, naiipon lahat ng kinakain mo, hindi lumalabas. Ayan, mga fats, mga salts, lahat ng kinakain mo, mga iniinom mong alak, ayan, nandyan nakatingga na sa iyong katawan. Then that cause lot of disease condition, like health condition. Yan, tapos high risk ka ng stroke. In women, life rests at the age of 55 to 75 years old. Kills twice as many like breast cancer and is third Third leading cause of death in women. Ayan. Ang mostly daw mga babae at the age of 55 dyan sila nagkakaroon ng ganyang sakit. What are the risk factors of stroke? Number one actually is hereditary. In the family. If it's in the genes of your family, ayan, nakicarried, but naaanuhan naman, nagagawan ng paraan, guys. Hypertension, yan, kung meron kang uncontrollable hypertension, ayan, it goes with the hereditary, kasi baka nasa genes nyo. Smoking, ayan, high blood pressure, cholesterol, too much alcohol intake, and high salt and fats intake, lack of exercise, ayan. How to lower risk of stroke? Number one, lose weight, ayan. Then nagkakaroon na ng exercise, ayan. Eat proper diet, low fat and low salt, ayan. Mga high blood, guys, iwasan natin ang high fat at saka maasin na pagkain, tsaka matataba, guys. Exercise daily, ayan, kailangan natin mag-exercise, walking lang, ganyan. Kailangan natin maging active. Check BP regularly to your healthcare team. Drink plenty of water, at least 8 to 10 glass a day. Ayan. Thank you so much, guys, at huwag kalimutang i-subscribe si post para updated kayo sa mga susunod kong topics. Ayan. Thank you so much, everyone. God bless.